In the name of God. This is Dr. Astabi, and I'm gonna continue blood circulation in session 5. Today we will discuss special circulation in different organs such as brain, and then we will discuss local control of tissue blood and which factors are important for local control of tissue blood. And then we will see what happened during chronic increase or decrease of blood flow. And finally, we will explain more about central regulation of blood flow. Let's see about blood circulation in the brain. About 40% of flow is seen in the brain, and the blood flow in the brain is about 700 milliliter per minute. In another word, blood flow is circulating in 50 milliliter per 100 gram of brain tissue. Brain have three different reflexes for blood circulation: Cushing reflex, vasovagal reflex, and acute ischemic reaction. Cushing reflex is talking about higher cranial hypertension in comparison to other blood flow. It means that the blood flow in the brain is a little higher rather than other blood flow in our body. Why that's important? It's important because we know that every time brain has some percent of blood flow, and in normal situation it's good because we know that nutrients and oxygen is always circulating in the brain. But during some injury or disruption of wall of vessels because of brain's higher hypertension, the blood goes to outside of the brain, and this is danger situation. Vasovagal reflex is a reflex for contraction of vessels and reduction of blood flow, and it comes from vasomotor and hypothalamus center, and it's act through vagus nerve. And the third reflex of brain is acute ischemic reaction. In acute ischemic reaction, when the pressure of brain is lower than 60 millimeter mercury, this reaction and reflex is happen and increase the brain flow to about 250 millimeter mercury, and this is the last survival reflex of the brain. And if this reflex is thin and other reflexes help to this reflex, maybe the brain blood flow start to increase. The heart circulation is about 44% of whole blood is circulate in the heart. About 200 milliliter per minute blood is flowing in the heart, and in other words, 70 milliliter per 100 gram of heart tissue has blood, and blood regulation in the blood flow regulation in the heart is based on autoregulation and some reflexes named Starling law, Bain bridge, and right atrium stretch that you learned it in the heart part. Also, the brain and heart has the autoregulation rather than regulated by the other part. It means that brain and heart very quickly respond to sympathetic regulation. When sympathetic action is done and brain and heart weakly respond to it, it means that brain and heart can do their blood flow by its own autoregulation. Liver has 27% of total blood, and about 1,350 milliliter per minute blood is circulating in the liver. In other words, 95 milliliter per 100 gram of liver has blood fluid. And in the muscle, only about 15 percentage of blood is circulating in the muscles, and 750 milliliter per minute is blood fluid in the muscle. About 3 milliliter per 100 gram of muscles, the blood fluid is about 3 milliliter per 100 gram of muscles. During rest, 20 percentage of capillary are open. But during exercise, these capillaries are going to open 4 to 5-fold times, and it means that during exercise the blood flow in the muscle is going to be high, and the whole blood is shifting to muscles during exercise. In the lung, you know that right atrium and pulmonary artery has lower pressure rather than left atrium and aorta. Right atrium pressure is about 25 during systole and 0 during diastole millimeter mercury. Pulmonary arteries has pressure 25 to 8 during systole and diastole respectively. And pulmonary capillaries pressure is about 7 millimeter of mercury, and left atrium pressure is about 4 to 8 millimeter of mercury. 20 percentage of lung, the blood flow, our whole blood flow is circulating in the lung is about 600 milliliter, and flow of pulmonary system is equal to cardiac output and the flow of systemic circulatory system. In local control of tissue blood flow, please be careful about these sentences. Any keys or stop of blood flow for any reason cause double blood flow after opening the vessel, and increase in tissue activity leads to increased tissue blood flow. Any reduction in tissue oxygen level cause increased tissue blood flow, and any increase in tissue blood pressure and oxygen level cause constrict vascular bed and reduce in blood flow. Let's explain more about acute local control of blood flow. During acute local control of blood flow, these mechanisms are seen. First, release of vasodilator factors, and need to oxygen and nutrients could regulate local control. Nitric oxide release, endothelin release during local control. And the last one is myogenic control, is because of contraction of myocytes. Before, we talked about reactive hyperemia and active hyperemia during local control, but some factors are in the humoral control is responsible for acute local control. For example, some neuropeptides such as substance P and histamine release for vasodilation of some parts for acute local controls. Also, endothelin is released by endothelial cells, and this is an important vasoconstrictor for acute local control. Myogenic reflex, it's related to endothelial myocytes, and by any disruption of vessels, the myocytes start to contract and contract the vessels by myogenic reflex. Let's see a little more about nitric oxide. You know, nitric oxide is an important vasodilator for local control of blood flow. Some factors such as bradykinins or shear stress, as we talked about, the force of RBCs and blood into the endothelial cells produce shear stress. Shear stress and bradykinin can increase calcium level in the cell, in the endothelial cells, and calcium could activate nitric oxide synthase or NOS, nitric oxide synthesis. Nitric oxide synthesis can produce nitric oxide through L-arginine and oxygen. As you can see in this figure, L-arginine and oxygen by nitric oxide synthase and other factors such as FAD, FMN could produce nitric oxide. Nitric oxide can activate soluble guanylyl cyclase, and this soluble guanylyl cyclase transfer guanylin 3 phosphate to cyclic guanylin monophosphate. Cyclic guanylin monophosphate has some different actions. One of them is relaxation of smooth muscles. So finally, nitric oxide could activate soluble guanylyl cyclase, and soluble guanylyl cyclase produce cyclic guanylin monophosphate and finally relax the smooth muscles in the endothelial cells. So this is the action of nitric oxide in local mechanism. Also, some vessels constrictors such as angiotensin II can produce nitric oxide. Yes, it's important. Angiotensin II can produce nitric oxide because of angiotensin II is a very powerful vasoconstrictor. And by stimulating nitric oxide production and relaxation of vessels, stabilize or balance the blood constriction and relaxation to inhibit the blood's powerful vasoconstriction and blood stopping in the vessels. Pharmacologic drugs that act on nitric oxide can be a therapeutic drug for vasoconstriction or vasodilation. For example, sildenafil is inhibitor of cyclic GMP phosphodiesterase 5. Cyclic GMP phosphodiesterase 5 decomposite and break up cyclic GMP. So sildenafil inhibits cyclic GMP phosphodiesterase 5 and then produce smooth muscle relaxation and increase blood flow. All we talked until here is about acute local control. It's related to humoral or um, nervous system control. But what happens during chronic local control? For example, what happens if the blood flow increase for weeks or months? What happens in our body? The first thing is vascularity or increasing the number of vessels by angiogenesis. Increasing the vessels named angiogenesis or producing a new vessels because of increasing metabolism or blood flow is named angiogenesis. So angiogenesis is related to some factors. For example, oxygen is important for regulation of angiogenesis. And in some people that living in the high or in the mountain, the angiogenesis is higher in that person. Other factors can stimulate angiogenesis. For example, vascular endothelial growth factor, some growth factor for vessels, fibroblastic growth factor, angiogenin. These are important factors that stimulate angiogenesis. And during angiogenesis and vascularity, the maximal blood flow is important for circulation of angiogenesis. It means that when the blood flow reaches to maximum level, angiogenesis is regulated or produced based on maximal blood flow. And what happens after the blood flow starts to decrease? So during reduction of blood flow after reaching to maximal blood flow, the some vessels start to collapse and reduce the blood flow in that vessels. So angiogenesis is related to chronic control of vascularity. During chronic control, vascular remodeling is another factor. Dependent to the vessel if be arterial or um, artery or capillary or veins, the vascular remodeling is different for them. For example, in arterioles, the thickness of wall of arterioles increase in response to higher blood flow, and this named inward eutrophic remodeling. And also related to dependent to different vessels, we have hypertrophic remodeling. It means that increase the thickness of um, vessels walls to outward remodeling. It means that increasing the radius of vessels to outward hypertrophic remodeling. It means that both hypertrophic of vascular vessels is seen and also increasing diameter of vessels is seen. So dependent on vessels, and it means arterioles or big arteries, where the different remodeling is seen during chronic local control.
Let's explain more about the humoral control of blood circulation. Angiotensin II, as you know, is the most powerful agent for vasoconstriction of humoral control. Angiotensin II, we will describe it more in the next slide. Vasopressin is another agent that increases blood flow, and other name is antidiuretic hormone. It's more powerful rather than angiotensin II, and vasopressin is secreted from hypothalamus and then posterior hypophyse and posterior pituitary, and posterior pituitary release vasopressin, and the vasopressin can increase blood pressure more than 60 millimeter mercury. As you know, epinephrine and norepinephrine are another vasoconstrictor agents. Norepinephrine is more powerful rather than epinephrine. Norepinephrine is secreted from sympathetic nerves, and they can increase heart rate and constrict veins and arterioles. Also, adrenal gland can secrete norepinephrine and epinephrine too. But remember, norepinephrine is more powerful rather than epinephrine. Even epinephrine can be a vasodilator in some vessels. So remember about the importance of norepinephrine on vasoconstriction. Here you can see two vasodilators, bradykinins and histamines. Kinins are small polypeptides that produce from alpha 2 globulins. At first, an enzyme named kallikrein in the blood can act on alpha 2 globulin and produce them to kallidin. And this kallidin can then convert to bradykinin. Bradykinin can dilate vessels and also increase permeability of capillaries. So kinins has important role in plasma and interstitial fluids exchange, and for permeability is important. The other vasodilator is histamine. Histamine is important and powerful vasodilator rather than bradykinin. Also, histamine can increase the permeability of vessels, especially capillaries. In some pathological conditions, extreme stimulation of histamine can increase permeability of vessels and send more blood and plasma to interstitial fluid and enhance the edema in that special organ. Here you can see renin-angiotensin-aldosterone system. Please pay attention to this. Well, let's start from the left side of this slide. At first, decrease in renal perfusion activate juxtaglomerular apparatus and they can produce renin. Renin release into blood and circulate, and renin can convert angiotensinogen, which is produced by liver, to angiotensin 1. Angiotensin 1 is inactive form. Angiotensin 1 then circulate in the blood and in the lung. ACE, an enzyme named ACE in the lung, can convert angiotensin 1 to angiotensin 2. ACE is abbreviated from angiotensin converting enzyme, and ACE is only in the lung. So, angiotensin 2 is a powerful vasoconstrictor. Let's see what's the rules of angiotensin 2 and mechanism of angiotensin 2 for vasoconstriction. First, angiotensin 2 can activate and stimulate sympathetic system, and also angiotensin 2 in the kidney can increase tubular sodium and color reabsorption and potassium exertion, and finally water retention is seen. Also, in the adrenal cortex of kidney, aldosterone secretion is stimulated by angiotensin 2, and also you know the rules of aldosterone. Aldosterone can reabsorb sodium and color and exert potassium, and finally absorb water. The other function of angiotensin 2 is arterial vasoconstriction and increased blood pressure. The final role of angiotensin 2 is acting on pituitary gland in the posterior lobe and stimulate the production of ADH or vasopressin. You know, ADH acting on collecting duct of kidney and enhance water absorption. So these are the renin-angiotensin-aldosterone system mechanisms for vasoconstriction and increased blood flow in the circulatory system. Also, you can see the rules of vasopressin. Arginine vasopressin acts through two different receptors, V1 and V2. V1 receptors is most seen on the vessels, adrenal gland, and acting on vessels. V2 receptors act on the nephron cells, and both of them, V1 and V2, finally increase arterial pressure. As you can see, V1 receptors on the vessels act through GQ and phospholipase C and then produce IP3 and deacylglycerol. But V2 receptors in the kidney act through GS adenylyl cyclase and producing cyclic AMP as second messenger. So V1 receptors increase systemic vascular resistance, V2 receptors increase blood volume and stimulate water absorption. Finally, both of them increase arterial pressure and increase blood flow. Here This figure shows the important regulatory centers for blood flow and circulatory system. The first and important center that you know is vasomotor center. Vasomotor center has three parts, and we've discussed about this. Let's see other centers, other subcortical and cortical centers that regulate blood flow. One of them is hypothalamus. Hypothalamus is acting on vasomotor center. The posterior side of the hypothalamus stimulate vasomotor center and vasoconstrict vessels, but the anterior part of hypothalamus can inhibit vasomotor center, so inhibit vasoconstriction and inhibit vasoconstriction of vessels. Also, the other important part is reticular substances. As you can see in this part, reticular substances can activate or inhibit vasomotor center. Lateral part of reticular substance can activate vasomotor center, and medial part of this reticular substance can inhibit vasomotor center. So like hypothalamus, reticular substance has different parts and different action on vasomotor center. Also, you can see the relation of vasomotor center by some other parts such as cingulate gyrus, mesencephalon, motocortex, and please be noticed that the dashed lines are inhibitory pathway and straight lines are activatory pathways. Dear friends, also remember that when sympathetic system is activated, they can produce norepinephrine, and also they can stimulate adrenal gland to produce epinephrine and norepinephrine. So the adrenal gland can be stimulated by sympathetic system and produce epinephrine and norepinephrine. And also remember that epinephrine can act as a vasodilator in some vessels, but norepinephrine is important and powerful vasoconstrictor in the vessels. Vasomotor center located in upper part of pons and lower part of medulla. There is an excitatory zone, and by activating excitatory zone, sympathetic system can activate, and also by activating there is an inhibitory zone, and by activating inhibitory zone, some activation excites from vagus system is inhibited and excitatory zone is inhibited. So as we said, vasomotor center has different parts: a vasoconstrictor part, a vasodilator part, and a sensory part that acts their function through vagus and glossopharyngeal nerves. We discussed this in previous sessions. We know hypothalamus is center for regulation of feeding, hunger, thirsty, appetite, temperature, hypophyseal hormone, and also a center for showing excitation, anger, fear, happiness, and all of these can act through hypothalamus. And one more thing that we know is that hypothalamus can act on vasomotor center and can activate vasomotor center. So we know the role of hypothalamus as a vasoconstrictor. So they can activate or inhibit vasomotor center. So they can act on vasoconstriction of vessels. The vasomotor center, how get information from the environment. We know there are two kinds of receptors: baroreceptors and chemoreceptors. Baroreceptors are in aortic arc and carotid sinus and send the pressure of blood monitoring through vagus and glossopharyngeal nerves to the cardioregulatory and vasomotor center in medulla oblongata. And by decreasing the pressure, the baroreceptors monitor their pressure and sense their pressure reduction, in, send some neurons to medulla oblongata and vasomotor center. So the sympathetic system is going to be active. Sympathetic system acting on blood vessels and heart, increase heart rate and constrict vessels to increase blood pressure. The other receptors are chemoreceptors. Chemoreceptors are sensitive to reduction of oxygen, increasing CO2 and hydrogen ion. When blood flow decreases, the level of oxygen is going to be decreased too. The level of CO2 and hydrogen ion is going to be increased. So chemoreceptors in carotid body and aortic bodies monitor these chemical changes and send the messages through vagus and glossopharyngeal nerves to chemoreceptor in the medulla oblongata area, and then the chemoreceptor area send excitatory neurons to vasomotor center to activate sympathetic change, and sympathetic system activation increase heart rate and also constrict vessels to increase blood pressure and increase the circulatory system to reduce oxygen, to increase oxygen level and reduce CO2 and hydrogen level. One of the important reflexes that regulate blood vessels flow is atrial reflex. Atrial reflex activate through increasing blood volume when the wall of atrium is going to be stretched, and also during activation or stimulation of stretch receptors of heart. They can, by activating atrial reflex, they can kidney artery dilation, increase in kidney blood volume and urine, blood volume reduction, ADH decrease, urine increase, decrease blood volume, ANP increase, salt and water secretion increase, and finally blood volume is going to be decreased. So by atrial reflex we can decrease blood volume. Vasomotor center has the inhibitory part, and this inhibitory part is not activated during normal life, but during sharp and heavy pain, heavy fear, hearing bad news, it could be activated and inhibit stimulatory parts of vagus nerve and increase vasodilation, and finally we can see loss of alertness during activation the inhibitory part of vasomotor center. So some reflexes increase atrial pressure and stretch atrial valves. Let's see what happened during this situation. Let's start from increasing atrial stretch. When atrial stretch is stimulated or stretch receptor is stimulated, it means that atrial volume is increased. We can see atrial volume reflex. Atrial volume reflex can do three actions. First, atrial produce atrial natriuretic peptide or ANP. So the level of ANP is going to be increased. Second, decrease antidiuretic hormone level. Third, decrease renal sympathetic activity. All of them can increase sodium and water exertion and decrease blood volume. Also, increasing blood volume can increase cardiac output and increase atrial pressure, and increasing atrial pressure can activate baroreceptor reflex, and baroreceptor reflex can act on sympathetic system activity, and finally decrease blood volume by increasing sodium and water exertion. And the other thing is that atrial stretch produces a reflex in the heart named vein bridge reflex. During stimulation of vein bridge reflex, the heart rate is going to be increased. So all of these factors regulate increasing blood volume by exertion of sodium and water, and also increasing heart rate and cardiac output. My dear friends, thank you for your attention. If you have any question, please ask me.